a new lab to do California testing for COVID-19. Down in Valencia, California, we cut the ribbon for a lab which really brings together our partnership with PerkinElmer to do 150 up to 150,000 new COVID tests a day for California when we hit full capacity. This will allow California to better serve schools and healthcare providers, our essential workers, hard to reach communities, individuals in congregate settings. We've talked about those settings as really high risk for COVID. And then, of course, disproportionately impacted communities, in particular communities of color. But back to schools, we knew this laboratory, and one of the key reasons the governor encouraged us to work on testing the whole time is he knew that it would be key to helping us bring children and staff safe to in-person education, which is a top priority for the state. The additional lab capacity is going to be provided and offered to school districts from around the state, not just nearby to the lab. At its full capacity, we know that monthly testing will be available to all teachers and school staff if those districts need it. In fact, we've been working hard with leaders and practitioners from our education community across the state to make sure that this effort is not only available, but that those districts and counties take advantage of this tremendous resource. In fact, just today, I've sent a letter to our school leaders and district leaders across the state, inviting them to review a newly posted playbook that describes how school districts and schools can take advantage of the lab at PerkinElmer to ensure that we have all of the different approaches in place, that we make sure that schools understand what they must do to take advantage of this, how the state is there to support them, and then how quickly we can make this resource available. I look forward to the days and weeks ahead as we bring in a few schools initially, few school districts initially to use the lab, and then expanding that by use of this new playbook to invite other school districts to take advantage of this testing resource as well. We know that there are many tools that help us bring students back in a safe way, and testing is one of them, but we are also working with our school partners on many others, and more to come on those efforts later. We know that we have taken a number of steps to bring schools back to in-person education. I'll remind you that we created a waiver process for elementary schools to bring the youngest California students back to in-person education, even in counties in the purple tier. We've granted over 1,300 waivers for school districts and counties across the state. We also issued guidance for how small supervised groups, we call those small cohorts of children, can return to educational environments safely. And these, again, are happening in purple tier counties. This guidance allows a focus on students with special needs, English learners, and other at-risk or high-need students who are at schools today learning in those small cohorts with staff on site and many of the COVID-specific protocols in place. So to our numbers, today we had 5,338 COVID cases reported to the state. This brings our 7-day average up to 4,471. We did just over 106,000 tests that were reported over the past 24-hour period, bringing our California 14-day test positivity to 3.3%. I'll also say that this gives us an identical 7-day test positivity at 3.3%. And I just for a moment wanted to juxtapose this to what we're seeing across the rest of the nation. If we had a test positivity for the entirety of the US, it would be 6.7%. So just over double what we're seeing here in California. We know that some states, and I know many of you are watching it closely, are seeing quite high test positivity, some in the high 20s, even low 30s across the state, the nation, and some nations across the globe similarly impacted. So although we're seeing some trends up here in California, those trends are modest, steady. We're watching them closely, and certainly not the same as many of the states throughout the nation. So as I said, this new wave of cases that we're seeing across the nation is not something that we are yet facing here in California. A lot of credit is to be given to each of you as individuals who are making decisions on a daily basis to lower their risk and choose different things that you might forego or do in a modified way. But also, our entire blueprint for a safer economy has also played a role in helping us avoid this new wave that many other states are seeing. You know that this blueprint for a safer economy allows us to move to less restrictive tiers in a thoughtful, slow, and stringent way, guided by data and science, focused on sectors based on their risk, and with clear, well-documented modifications that those sectors are expected to put in place. And then, of course, adherence to all of the public health guidance that we've been discussing over many, many months. Again, these actions are, and I'll remind you again at the end, wearing our face masks, face coverings, limiting our mixing and avoiding big crowds, washing our hands, practicing physical distancing, and staying at home when you're sick. And I'll emphasize this last one because as we get more individuals with respiratory illnesses, even if it's not COVID, just the question of, well, is that sore throat? Is that mild fever COVID? Encourage people to get tested, but especially, even if you don't think it's COVID-19, to stay home, avoid getting others sick, because certainly we want to keep not just transmission of COVID down, but all of the respiratory illnesses that we usually see during the winter. In California, we are starting to see some increases of cases and test positivity. You've been tracking that now over the last couple of weeks, and we continue to monitor our data very closely as we move into colder weather, shorter days, so more push to move inside, and of course, the upcoming holidays that I know many of us are looking forward to. And just a reminder that over the past couple of weeks, we've seen this uptick. Say on October 20th, we had a test positivity of 2.6% statewide. Today, we've come up to 3.3%. We've seen our hospitalization numbers after enjoying weeks, even 2 to 3 months of steady decreases. We have seen over the past 14 days a double-digit % increase at 13.5 in our hospitals as it relates to COVID hospitalizations, and then in our intensive care units, nearly a 20% increase over the past 14 days. We always know when we see increases in our case numbers that roughly 3.5 weeks later, we'll see that manifest in hospital increases. So these are not surprising. Our hospital system, who did incredible jobs preparing over the spring and early summer months to remember those conversations about surge capacity and surge beds, that's all still with us. Our hospitals are able to utilize that if need be. So even though these increases are not themselves the parts that will overwhelm our hospital system, certainly having this sustained double-digit % increase over many, many weeks will put our hospitals in a difficult position during flu season and when we're trying to keep up with all other routine healthcare that Californians need and deserve. I wanted now to just take a few minutes, and we've alluded to this concept of pandemic fatigue. Many of the reporters that I have a chance to talk to mention this phrase, and it is something that naturally 8 or 9 months into our response is real. And we know that the pandemic has altered our way of living. We've all made sacrifices. Some we've been okay with, others have been really hard. And each of these sacrifices has helped us slow the spread of COVID in our state. And I would say Californians have done an incredible job throughout the state, whether you're in the far north or the far southern part of our state, the eastern side or along the coast. Everyone has come together to really make a contribution to getting the state to where we are. And that work has not come without a cost. Many of us feel exhausted, fatigued, and frankly impatient, and that is truly understandable. But we have to keep these efforts up, as we know cases can begin to skyrocket quickly. And as we see these modest but steady increases in our case numbers, what we all want to be able to do is, in that face of increases, ensure that they don't go from a couple hundred to a couple thousand increase to many, many thousand increases over the next weeks. So what does this mean? We must continue to stay the course. Much of California has, a mild weather change, that it's a little colder than it was some places, significantly more colder than it had been in the weeks and months past. And hopefully we can bundle up and still keep a lot of our activities outdoors. We know that's increasingly difficult, but still something we should try and aspire to. And we know there's ways to continue doing many of the things you love, but in a modified way to reduce your risk and the risk of those around you. It isn't to say you can't do many, many of the things. It's not just the what we do, but the how we do it. The future is indeed uncertain, although we've learned a lot about COVID in the past many months. There's still learning to be done, and we know that this requires us to remain vigilant, and it will help us have success in the weeks to come. As we enter flu season, again, another reminder to do these basic things that you see here listed, and to use this as an opportunity to visit covid19.ca.gov to see the many resources available to you. Also encourage you in your own counties to visit your own local public health websites, because they have specific things to your county, help you understand how your public health experts are thinking about transmission in your backyard, which will of course inform how you make decisions, not just today, but in the weeks to come. So on to our tier assignments. Another reminder to say, our blueprint for a safer economy is our strategy. We've been at it now for just over 2 months that creates the criteria for loosening and tightening restrictions. Every county is assigned a tier based on these 3 different metrics: test positivity, an adjusted case rate, and a health equity metric. And I will share that a few weeks ago, when we announced the health equity metric, we had lots of questions from Californians, including our own public health partners, asking about how it would work and how it's not just an indicator of how to slow movement forward through the tiers down, but that it also created a way to accelerate some movement through the tiers. And many counties have benefited from the health equity metric. We have seen deepened engagement on how we stay laser focused on making sure all of our communities, the transmission in those communities is addressed in an equitable way. And I will say, I think California should be really proud of the wonderful equity work we continue to do in regards to COVID, and how it is a positive factor in our tier assignments, as you'll see. To remind you, we have the 4 tiers: red, orange, and yellow. That's widespread, substantial, moderate, and minimal transmission. And you can see that each is attached to an adjusted case rate, a positivity rate threshold, and a health equity threshold as well. I wanted to put this slide in today's presentation just to show how far we have come. When we first announced our tier assignments, we had 38 tiers in widespread, purple, and just 2 in yellow. Today, even though we have 1 more than last week, we have 10, nearly 75% of the counties have moved out of purple tier into at least the red tier. And then a significant number, we have 5 times the county nearly in minimal or yellow than we had when we started. So our slow and stringent approach has allowed many counties to move forward in our tier assignments and allow additional business sectors to begin operating and some of those other business sectors to increase their level of operations. So what are our new assignments today? We have just one county moving forward, which I think is an important reminder that the baseline transmission rates of COVID across our state are indeed going up, that it's not just in 1 or 2 counties, but it's widespread across the state. We, of course, have those counties in the southern part of the state that we've been keeping an eye on. 4 large counties in purple, a couple of other large counties who have been in red and have seen their data suggest that maybe they would be moving back to purple if things don't begin to stabilize and come down. So this is the first week where we've only seen one county move forward, and that's Colusa, moving from the red to the orange tier. We have one county moving to a more restrictive tier, that's Shasta, who's moving from red to purple. A couple of weeks ago, we were talking about Shasta with many of you, working closely with their county leadership, their public health leadership, watching the data stabilize in the short run, looking at their most recent 10 days of data, and felt at that time that Shasta could stay in the red tier. But after having more time, continuing to look at the data, working with the county, it's clear that the spread is not just isolated to a couple of venues or locations, but that it is really throughout some big parts of their community. And it allows us to say, yes, now is the time to put the brakes on a little bit, go back to purple, stabilize, work with the county to make sure they have enough testing, contact tracing, that we understand transmission as we work to get back into a less restrictive tier in the future. And then we have one other small county moving back from yellow to orange, and that's Plumas County. So before we open it up to reporter questions, I'll remind you for a third time, and we continue reminding folks what it is that we hope and expect, because these are indeed the tools, our best tools to reduce transmission. It's wearing our mask and doing it as much as we can, even when we're around people that are outside of our household, but that we know very well. It doesn't mean you can't still transmit or get COVID, so wearing the mask is still a very powerful tool. Maintaining that physical distancing, washing your hands, minimizing all mixing if you can, and or minimizing mixing as much as you can, and then never miss a chance to remind you that if you haven't already, please get your flu shot, make an appointment, find out where you can get your flu shot, and do that immediately. So not only are you protecting yourself and your immediate household, but your community, your healthcare delivery system, and many others as we continue our fight with against COVID and keeping transmission rates as low as we can in the state of California. So with that, I'll open it up to the first question.
Monica Coleman, ABC 10. Monica Coleman, ABC 10.
My question is regarding holidays. When will guidelines come out regarding what people can and cannot do? How can they safely celebrate the holiday season with Thanksgiving this month, and Christmas is around the corner?
Yeah, excellent question. We're working hard. We're working with our local public health partners to make sure that what we put out is, that people receive it well. I think that a lot like when I'm in my clinical practice, we know that we might be able to diagnose and really pinpoint what the issues are, but really making a plan that is relevant and that people can understand how they can put it into play is one of our top objectives. So with our messaging and our guidance with around the upcoming holidays, we want to be sure that it really does strike a chord with our all Californians that they can imagine how they can implement it as we look forward to a time where we may see people we haven't seen in quite some time. So that's coming very, very soon. We have to put some final touches on it, but we wanted to make sure that it's certainly relevant and applicable to all Californians as we put those out, because we recognize that guidance that isn't put out in that way may not be received as well and may not actually achieve what we hope to achieve, which is ultimately allowing people to have those tools and guidance to reduce risk while they enjoy the upcoming holiday season.
Ron Lin, Los Angeles Times.
Hi, Dr. Ghaly. Thanks again for taking our questions. Really appreciate it. I'm hoping you can again offer some perspective on this kind of confusing picture I'm seeing with the data. It's kind of hard to communicate. So obviously there's some sense of concern. LA County seems stuck in purple for the rest of this month, but there are some good signs, relatively speaking. You said that California is not seeing the third wave that the nation is seeing. So here are the questions. If we're not seeing the national third wave, but we're seeing an uptick in cases, how would you characterize what we're heading into? Is this actually a good sign that California's next wave might be modest, or are we just delayed from getting into our dark winter? Some counties across the state have mentioned gatherings are our main problem. You see, this is the main problem we're seeing statewide. And do you get the sense that one of the reasons California is doing well is that we're just wearing masks more often than residents of other states?
Yeah, I think all really excellent questions. And we have seen an uptick. There's definitely more COVID transmission in our communities, but I think part of California's success is because we have gone really slow with our reopening, that we've allowed ourselves time to see how our reopening efforts impact our healthcare delivery system, that counties are reporting a tremendous capability to reach out to identified cases and do that contact tracing, disease investigation, make strong recommendations around isolation, and really supporting people to make that choice to reduce transmission. So we know that as we see cases come up, that it's not just about counting the cases, but doing something about each case so that we don't have further transmission. I do believe that Californians, where we're seeing high use of mask wearing, we're going to see one of the most valuable tools at play to reduce transmission. So that certainly plays into it some. And as I say and have said before, just because we've seen other parts of the country experience a surge, it's not a foregone conclusion that we'll just see it down the road. We have a lot of agency. The governor has talked about how our choices matter a great deal. It's not often only what we do, but how we do it. And I think your question really gets to the heart of that, which is we can keep transmission low, even though it goes up some. Using our public health tools and our own personal choices, we can certainly keep transmission lower. I think your question about family gatherings, private gatherings is a key one. We've been talking about it for months. Most counties report those gatherings as a significant source of the spread that they identify. And to the question earlier about Thanksgiving and other holidays, I think that's why it's so important that we're working hard to come up with a message that really resonates with Californians, that says we can still do and enjoy many of the things that we expect, but while keeping a close eye on things that we can actually apply to reduce risk and keep transmission low. So I believe that if we put all of those together, we might avoid some of the really high surges that we're seeing on other parts of the country and really get through what will be a difficult few months with, hopefully good headlines about how we did all we can to keep transmission down in California.
Amy Taxon, The Associated Press.
Thank you so much. I appreciate taking our questions. You said you believe that California's policies on COVID have helped keep the cases down more than other parts of the country. Can you be more specific about which sector guidance or which policies? And also looking at San Diego and Sacramento counties, can you discuss what is driving infections in those two counties? And do you anticipate them both returning to the purple tier in light of the numbers this week?
Yeah, I think to the first part of your question, the specifics, I think we learned early, early in the summer that, being outdoors and having as many things outside as possible really does make a difference. So I think our approach to keeping as much of our activities outdoors, even in the formal business sectors, as much as possible, has contributed quite a bit to keeping transmission low. Going along that is really clear guidance on when masks and face coverings should be used. I think those go a long way as specific policies that are deeply ingrained and embedded in almost every sector guidance. And then moving forward slowly. Uh, Early on, when we were reopening at the late spring, early summer, we were making decisions based on data that was just 2 weeks old and making changes much more quickly. Now we go slower, and we believe that gives us significantly more time to see how the impact of certain sector changes uh, play out in our case numbers, our test positivity, as well as our hospitals and ICUs. So all of those sort of foundational principles are built into the blueprint and allow me or cause me to say that we attribute some of our success to that. When it comes to Sacramento and San Diego, we know that some of the same areas of concern are there. Congregate care facilities in both these counties are an important place where we've seen spread, and being able to work with local public health partners, the operators of those nursing homes, skilled nursing facilities, residential care facilities for the elderly, other congregate care facilities is a key part of our strategy, which we have improved and made augmentations to over time. So it is a belief that we can do more now in those environments than we did early, as well, really delivering stronger and clearer and more usable messaging on how to have family gatherings in a way that lowers risk. I think those are key uh, interventions that we will continue to build on. That gives me some hope that any county that is teetering on moving into a more restrictive tier has the tools to either avoid that by getting transmission down, or hopefully, if they do go to a more restrictive tier, to be able to stabilize, bring transmission rates down, and then move into a less restrictive tier more quickly. I'm not sure if San Diego and Sacramento will move back. We're certainly working closely with those counties and their leaders to do all we can, not to, in the end, prevent them from moving to a more restrictive tier, but really to control transmission, because we know that is what communities need to have lower risk, less transmission, and to be safer overall.
Paul Sisson, San Diego Union Tribune.
Thanks for taking my question. I wanted to bore in a little bit more to San Diego's purple score in this week's report. There's a footnote on the chart this week that says San Diego is both undergoing county tier adjudication with CDPH, and also that they are entering into a supportive engagement with CDPH. And I wondered if you could explain a little more about kind of what exactly is going on there, what kind of things you guys are counseling. And then also I had a second question regarding hospitalization rates. There have been a lot of calls recently for less stringent, faster reopening pace due to the fact that hospitalizations have tended to trend relatively flat, and especially in my area, quite flat and even down a bit. And so, I wonder how you feel about those calls now that we're starting to see hospitalization rates really increase in a lot of other states.
Yeah, thanks for all of those questions. So the tier adjudication status that you mentioned, really what we're looking there is the county has asked us to look at some specific data to make sure that it's complete and accurate, so that the data that we post is complete, because both decisions moving county to a less restrictive tier, as well as moving to a more restrictive tier, are important decisions, not just between public health to public health, but for the entirety of a community, the business sectors, others. So we don't take these decisions or posting of the data lightly, and we want to make sure that it is accurate. And if a county has concerns, we have a process for them to share those concerns and us to address them. The supportive engagement is what we provide each county that looks like they have missed their current tiers thresholds for 1 week. It allows us to work closely with the county to understand what are the supports and resources that that county might need in order to better understand and mitigate any transmission increases that they're seeing. Often these aren't themselves the things that will immediately stop a county from meeting that second week threshold. But again, the whole blueprint isn't just about moving forward or moving back. It's about having the targeted interventions to ensure that we're reducing transmission across that county so that the public in those counties can feel safer and more confident as they move about. To your question about hospitalizations and whether the calls to have what I call a hospital metric as part of our tiering and our blueprint, we have heard those, and we deliberately chose not to have a hospital measure because, as we've said earlier, it's a lagging indicator. As cases begin to rise, I can almost predict 3.5 weeks later that there'll be some increase in hospitalizations. But between that 3 and 3.5 weeks, it could be a significant or an insignificant or smaller increase. So we have chosen not to use the hospital metric as part of the blueprint and tiering system for moving a county forward. Of course, as we look to moving counties to potentially more restrictive tiers, we take into a number of factors, including the stress and tension on the local healthcare delivery system, including hospital and ICU beds, ventilators, the use of other personnel, and making sure that there's enough to staff the beds. All of these are factors as we think about case increases. I think at the moment, apropos your question, you basically answered it in part yourself. We feel confident, especially as we see other states quickly and sort of dramatically get overwhelmed in their own healthcare delivery systems, that we've made the right choice and that this is where we'll be for the foreseeable future.
Angela Hart, Kaiser Health News.
Hi, Secretary Ghaly. The other day, Covered California's Peter Lee said that coming up with a replacement plan for Obamacare was like adding ships to the Titanic. And legislative leaders have echoed the same sentiment. So I wanted to hear from you. Can California come up with a replacement plan if the High Court does strike down Obamacare wholly or in part? Or, Secretary Ghaly, do you think is it impossible for California to do this sort of contingency planning for something that, groups are telling me would be such a devastating blow to California?
So thank you for the question. And I think as we all look closely to the future of the Affordable Care Act, I'll remind you that California has done more than any state, I would say, to implement and build upon the Affordable Care Act to really improve coverage and deepen our commitment to getting everybody the coverage and access to care in California. We've made dramatic improvements in the rate of those who are uninsured. And, that's the buildup to say it will certainly be difficult. And I've used the phrase catastrophic if the ACA were materially changed or repealed. And California, of course, in the face of a lot of difficult times and catastrophes, to bring our best thinkers together, our best minds to see what we can do to keep the forward movement going. And we will always be prepared to do that. But I'll remind you, as you know well, that we still have a lot to see how this would play out. And we're, of course, all hopeful that California will be able to continue building upon what we have today, rather than having the conversation we might be if there's a material change to the Affordable Care Act.
Spencer Custodio, Voice of OC.
our questions. This talk, especially in Orange County, I guess the health officer has been speaking with some other health officers, and they would like the health equity metrics to be somewhat revised, I guess a little lower, so they can potentially move to, I think we're in the red tier right now, so they can move to the orange tier. Is there any conversations or any thoughts on any movement on that front? Maybe increasing the threshold or lowering it so counties can move forward?
I have not been contacted with that concept or idea. I will say that what we've done with the health equity metric is really require and encourage counties to work to get communities across their county all to a similarly low level of transmission as based on test positivity. And I would be remiss to deviate from that in any material way, because we know that not only is it important that we have transmission rates low throughout the communities for the sake of those communities, but also countywide to ensure that we don't risk having high transmission communities really have that end up being the entire county's transmission rate. So we believe that the way that the health equity measure is applied today is the right way at the moment. But of course, as we've always done, we take feedback from our local partners, trying to understand what improvements they might suggest. And if reasonable, we do end up implementing that. So I look forward to hearing whatever opinions and thoughts and improvements that people might share. But I haven't heard that as of yet.
Claudia Pechueta, KNX News Radio.
I know you're still working on the holiday guidelines, but San Francisco is considering asking for a 2-week quarantine for holiday visitors. Is that something you think that perhaps should be considered by other counties or maybe even statewide? Thank you.
Yeah, I think it's an excellent question, and I think they aren't alone. Other states and other regions have considered that, and I'll just commend that it's, I believe, not just San Francisco, but the Bay Area, and we've seen throughout this entire response, regions come together, the Central Valley, Southern California counties, different regions coming together to plan together, and the Bay Area has certainly been a leader in this throughout the response, and again, are considering it in this capacity. Of course, I think that it's a very reasonable thing to consider. The idea that different geographies and different communities have higher and lower rates of transmission. It's important, just as I mentioned in the health equity measure, to consider how restricting or limiting the ability to move from higher transmission areas into lower transmission areas may fit what a community needs to keep transmission low for themselves. So really looking forward to see how the Bay Area counties come together on this, to see if there's something that's applicable that should be considered in other regions or statewide. So open question, certainly something that we believe is part of our entire effort to keep transmission low, reduce mixing, and ensure that we prepare California for the next many weeks and months to come.
John Farinini, Bay Area reporter.
Good afternoon. In July, of course, it was announced by your office that sexual orientation and gender identity data would be collected for COVID-19 patients. And at least at some test providers, this hasn't happened. At City Test, for example, here in San Francisco, they ask about non-binary status, but they don't ask about sexual orientation. And so I wanted to ask why this is. Was there a delay in the time for people to be compliant with the order, or what's going on with it?
Yeah, I don't know the specifics. Again, it's a fairly new order and expectation, and I think we can certainly always find those exceptions, and I don't want to minimize it in any way. We'll look into that specific issue, and always interested to hear from those who are asked to put into practice some of these changes, what the difficulties are, whether there's reasons that it's delayed, that we can, at the state level or the local level, help intervene and support. So I will just highlight that we are getting more and more of the sexual orientation, gender identity data attached to our cases. It was not just something we expected of the test collection sites, but the labs reporting on the data as well. So we'll see, as we have seen with many other things, some steady increases and improvements here. But of course, there's going to be some entities that we know either didn't put in play into practice the expectations, and those are all worth following up.
Final question, Colleen Shelby, Los Angeles Times.
Hi, thanks for taking my question. Given that the possibility of mass protests are kind of quickly upon us, I'm wondering if there's any concern that that sort of activity, could cause a greater spread of the virus as transmission is rising, or if that is not of concern, given that that did not seem to be a problem earlier this summer.
I'll say there's always concern when we have random large-scale mixing. I think we have tried and continue to provide ways to reduce risk in all of these different environments. And certainly my hope is that we don't pinpoint any transmission to the activities that come together, whether they're in the protests that you're mentioning, or even the family gatherings that we anticipate as we enter the holidays. But I feel more confident that with the right tools in place, that some of these things where we know the risk is higher can be at least that risk be mitigated some. So we'll see. As with everything, we talk about the different holidays, the different events. We talk about upcoming sector openings and those places where we see some transmission increase. But we always hope that through our choices and the way that we do things, not just what we do, but how we do it, we can reduce some of that transmission risk and ultimately transmission overall. So with that, I thank you for bearing with me on what was a longer than usual presentation. I really hope and expect that we'll continue to do the work that we've been good at for the last 8 months, that we'll do our part to keep transmission in our communities low. We know that there's some changes ahead, and that we'll be doing all we can to not have that second or third wave, whichever way you want to look at it, that the rest of the nation's experiencing, and try to tampen that down as much as possible here in California. And to do that, we need and enlist all of you to work with us. And I'm just grateful in advance for all the work that you will do, and of course, for all the work that you've done to help California do well as it relates to COVID-19 and our response. So with that, I look forward to seeing you not next Wednesday, but next Tuesday in this Zoom, and maybe earlier with the governor. Have a good rest of your afternoon.